Hey everyone, this is my presentation on infant meningitis. Alright, so the etiology. Meningitis is an infection and inflammation of the meninges in the brain and the spinal cord. These meninges are the dura, arachnoid, and pia mater, as you can see in the picture. These are the tissues closest to the brain, so it is important to catch this infection fast in a tiny human. Some causes of this. Bacterial is most serious and it can be sometimes fatal in infants. Group B streptococcus, what we know as GBS, and E. coli are common in newborns, and these are common because these two bacteria can be transmitted during a vaginal delivery. A viral cause is also called aseptic meningitis because there is no bacterial living component to it. Enterovirus is a common viral cause of meningitis in children. It's treated aggressively as bacterial meningitis until diagnostic tests confirm the viral cause. So they're pretty much treated the same until we really officially know that it's viral meningitis. It is less serious. It can be asymptomatic and it has an abrupt onset of symptoms. Meningitis can also occur secondary to a different infection, like an ear infection, sinus infection, throat infection, or pneumonia. It can also be a result from brain trauma or surgery, only because anything that is close to the brain or possibly introduces bacteria into the brain can cause an infection. Bacterial causes of meningitis are the most common in infants, so we will mostly focus on that aspect of meningitis for this presentation. Pathophysiology. So meningitis infection occurs when an infectious organism spreads from the bloodstream to the central nervous system. Pathogens can cross the blood-brain barrier easily, and then they multiply in the cerebrospinal fluid. This initiates the inflammatory response that occurs with infection. This can lead to an inflamed and edematous brain. The edema occurs from increased volumes of intracellular and extracellular fluids. This leads to cerebral edema and an increased intracranial pressure. This is also known as hydrocephalus. The ventricles can also become inflamed and therefore obstructed, and this leads to diminished flow of cerebrospinal fluid. All right, so some risk factors associated with infant meningitis. One big one is an untreated GBS positive mother. So as we know from our OB lectures, GBS is a bacteria that is common in the gut, however can cause problems when it is transmitted to the infant during vaginal delivery. To be effectively treated for GBS, the mother must have had prophylactic antibiotics for 4 hours prior to birth. So if this mother was not able to get to the hospital in adequate time, or if the baby came before all the antibiotic was through her system, then there is a possible cause of transmission. This is the most common cause of infant meningitis. It can also trigger deadly complications like sepsis and pneumonia in neonates, and these often are fatal for them. Another risk factor is being around children or adults who are not vaccinated. So many vaccines protect against infant meningitis. One is the Hib vaccine. It protects against meningitis caused by the Haemophilus influenzae type B. And the first dose of this is given at 2 months old, and it's about a 3 or 4 dose series. Another vaccine is the PCV13, and this protects against illness caused by Streptococcus pneumonia and pneumococcal disease. This first dose is given at 2 months out of a 4-dose series. Meningococcal vaccine. This also protects against illness caused by Neisseria meningitidis, or also meningococcus. And then this dose isn't given until 11 years old, and it's a series of 2. So that one isn't given until the child is way older. So because infants cannot receive most of their vaccines until they are 2 months old, they have to depend on those around them to be vaccinated to reduce the risk of transmitting one of these deadly infections. So it's a good education topic for your parents and for anyone who is around an infant to make sure that everybody is vaccinated so that the risk of transmitting this disease is decreased. All right, complications of infant meningitis. So one of the big ones is that it may trigger the syndrome of inappropriate antidiuretic hormone, also known as SIADH. Meningitis, as we know, is an infection that can cause damage to many parts of the brain. ADH, antidiuretic hormone, is made in the hypothalamus and is released in the pituitary gland. And ADH helps the kidneys conserve the right amount of water. So any dysfunction with this can cause a lot of problems with our fluid and electrolyte balance. When the brain has an increased fluid and pressure on the ventricles, it can put more pressure on those lower structures and cause them not to function correctly. So as you can see in the picture, the hypothalamus and the pituitary gland are lower than the ventricles and basically the whole the whole brain itself. So any increased pressure in these structures will put more pressure on those bottom structures. SIADH occurs when the body produces too much ADH. The body will retain water and dilute the sodium in the body, and that can lead to hyponatremia, another complication that can cause problems in infants. Other complications of infant meningitis can be a hearing impairment, gross neurological deficits, and behavioral or intellectual disorders. So unfortunately, because meningitis occurs in infants, and we are not able to see how much deficits that they may have at that time, continuous monitoring throughout this child's life and support for the parents is required to see what develops over time. All right, signs and symptoms in the infant specifically. So the infant may have a fever. They may have a change in feeding pattern, and they're probably being breastfed at this point, so the mom should know pretty well how they're feeding. They might have vomiting or diarrhea. They could have a bulging fontanelle. However, this can stay flat, so that isn't a definitive sign that we look for. They could have an increased head circumference. The infant may be alert, restless, lethargic, or irritable, so kind of all over the spectrum, but not really consolable. The infant also may be irritable with normal comfort measures like rocking or cuddling, and this can be a telltale sign that something's wrong. They also might have nuchal rigidity, so this is when their neck is very stiff, and it's because of all the inflammation in their brain and their spinal cord. And if you try to move their head or flex them at all, the whole body will kind of move. They also might have a petechial rash, and this is usually happens when the cause is from meningococcus. And they also could have a positive Kernig and or Brzezinski sign. So assessments that we want to make in this infant, we definitely want to assess their vital signs and we want to continue to monitor. So if that child does have a fever, we want to monitor that and make sure that it's coming down to prevent any more damage. We also want to assess their nutritional intake and pattern. So again, asking that mom if there's been a difference in breastfeeding times, if they're feeding less, if they have bigger intervals within feeding. That's very important because we also need to assess their nutritional status. We also want to assess the amount of output that the child's having through vomiting or diarrhea, in addition to wet diapers. So we learned that you can have at least 6 to 8 wet diapers a day, and that's about normal. And if they start to have less, then that could be indicative of dehydration. We also want to assess the state of the infant. So this is their arousability. So if they are alert or if they're irritable or if they're pretty lethargic and you can't really wake them up. We also want to look at their head, eyes, ears, nose, and throat. Again, because this meningitis can be caused by other infections like a throat infection or an ear infection. So we want to see if the causative bacteria is possibly coming from this infection or somewhere else. Meningitis can also cause complications like hearing deficits or nerve problems. So we want to assess the cranial nerves as best as we can in the infant to see if there's any detectable deficits. If they are having GI symptoms like vomiting and diarrhea, we want to assess their abdomen, bowel tones, just to make sure that there's nothing else going on in their stomach. And then for these Kernig's and Brzezinski's sign, it's important to assess because these are specific for meningitis and because of that nuchal rigidity. So the Kernig sign, you raise a child's leg with the knee flexed and then extend the leg at the knee. So kind of point the toes toward the ceiling. And this is deemed positive if there's any resistance or pain. In this video at the bottom, it is very definitive that there is a positive Kernig sign because the child just starts screaming. For the Brzezinski sign, you want to flex the child's head while in the supine position, kind of tuck their chin to their chest, and it is positive if their hips or their knees involuntarily flex and form kind of like a crescent shape. So this video is great at showing these two signs in addition to nuchal rigidity. I highly suggest that you check them out. Diagnostics. So we can diagnose this on clinical presentations, obviously not alone, but there are some pretty strong signs that can show that there's a problem going on. Lab tests, we want to do a CBC to look at white blood cells, make sure that there's an infection. We can do a blood culture because this infection has traveled through the blood to get to the brain. We can also do serum electrolytes and bun and creatinine levels to determine the fluid and electrolyte status of this infant. We can also do a lumbar puncture for cerebrospinal fluid and evaluate it for white blood cells, proteins, and glucose levels. We can also do a culture based on, or a culture for the type of infectious organism. We can do a CT scan, however, this will only show increased intracranial pressure or possibly an abscess. So this is more just to add on to other diagnostic tests. For monitoring, we would definitely want to monitor vital signs, especially temperature, intake and output, white blood cell levels, the state and neurostatus, in addition to like the head circumference. We also want to measure their sensory responses, make sure that they're responding in the way that we want them to. And in addition, we also want to monitor their response to the antibiotics, just to make sure that they're working. Medications used to treat infant meningitis, obviously IV antibiotics. These are administered very fast after the diagnosis is confirmed. However, they might change once we know exactly what infectious organism is causing the infection. Normally ampicillin and a third generation cephalosporin is given. One that we see often is ceftriaxone. Other antibiotics can be given, like penicillin, aminoglycosides, and vancomycin. Again, this is just dependent on what kind of organism is causing the infection. Dexamethasone is also given. It's a steroid that can reduce inflammation, and it's given usually in cases of the Haemophilus influenzae infection. This can help reduce the severity of any sensorineural hearing loss because meningitis can cause many complications. We want to try to minimize those as much as possible. We can also give Tylenol for fever control. Other supportive measures that we can do for this child, IV fluids with electrolytes if they're dehydrated, and this can also help manage the pressure in their brain. Supplemental nutrition, so they might need a feeding tube because they might be MPO due to risk of aspiration. They might be on seizure precautions. Seizures are rare, however, we want to protect them from any more damages that they can have. And also positioning. So as you can see in this picture, the child is kind of laying with hyperextension of the head and the neck. That's called the opistotonic position, and it's just basically what's most comfortable for them. So we can help the child by letting them remain in this position and be comfortable. All right, so family education. The child may have to go home on IV antibiotics, so we need to teach these parents about care of the IV line, and then also if they have any deficits present, we need to educate the parents on how to manage these problems. If the cause was a mother's GBS during birth, then we can educate the family for future pregnancies on the importance of getting to the hospital early enough and starting that prophylactic antibiotics as soon as possible. We also can encourage the parents to have anybody around them get vaccinations. We need to, as nurses, provide accurate and unbiased information to fill in any gaps of knowledge that the parents may have. Support for the family. So we want to develop a trusting relationship with these parents because they might be with us for a little while. We want to make a space to let them openly talk about their fears and concerns because this is a life-threatening condition and they might be very scared about what their child is enduring. During procedures, we want to accurately and carefully explain what's going on and how they are helping the children. We want to let them interact with the child and allow them to provide comfort. We can refer them to home health, the financial office, or whatever the family needs. Here are some family resources. They're very helpful, and we can also refer the family to websites that have a lot of information. Here is a summary slide to just wrap up all the points that I've mentioned in this PowerPoint. Thanks for listening, and I hope you learned something.